Okay, here we go. So it's my pleasure to welcome you all here for our graduation of the class of 2018. I think they're all dry from this morning. And although they were officially graduated this morning, we'll call this the dry graduation. I want to, before we begin, take a moment to thank all of the staff who were here, who organized today. This is a big endeavor, and we want to thank Dr. Lisa Moscoso, our Associate Dean for Student Affairs, and Cami Taylor and Kathy Torres Stewart from our Special Projects Office and our Office of Student Affairs and the Registrar's Office. Let's give them a round of applause. It's my honor now to introduce our commencement speaker. Dr. Adil Haider is a trauma surgeon at Brigham and Women's Hospital and the Kessler Director for the Center for Surgery and Public Health, which is a joint initiative of the Brigham and Women's Hospital, Harvard Medical School, and the Harvard T.H. Chan School of Public Health. He currently serves as president of the Association for Academic Surgery. Dr. Haider went to medical school in Aga Khan University in Karachi, Pakistan, and then came back to the US for his training in general surgery at New York Medical College, training in surgical intensive care and trauma surgery at Johns Hopkins, and he also has a degree, an MPH degree from Johns Hopkins. His work has led to recognition of racial disparities in outcomes from traumatic injury and the establishment of the field of trauma disparities research. He is regarded as one of the foremost experts on healthcare inequities in the United States, with projects focused on describing and mitigating unequal outcomes based on gender, race, sexual orientation, ethnicity, age, and socioeconomic status. His other research focuses on long-term clinical and functional outcomes after trauma and emergency general surgery, optimal treatment of trauma and critically ill patients in resource-poor settings, and advanced analytic techniques for surgical health services research. Dr. Haider believes that equality is the cornerstone of medicine, and his professional goal is to eradicate disparities in healthcare in the United States. We are very honored to have him here today, both as our speaker and a wonderful role model. Dr. Haider.
Good afternoon. Come on, we can do better than that. Good afternoon. There we go. This is going to be one of those kind of speeches, all right? Dean Perlmutter, thank you very much for that very generous introduction. Dean Moscoso, faculty, the parents, and of course the students. Congratulations on graduating another class from the Washington University School of Medicine. I want to start with congratulating all of your supporters here today. Your family, your friends, your siblings, your spouses, your partners, and of course, most of all, your parents, who made today possible for all of you. Congratulations. Now, I must say, when I was invited to give this address, I was very surprised. I mean, I'm deeply honored, but very surprised. Like, why did you want a trauma surgeon here? And so I tried to figure out what's going on, and I Googled Washington University class of 2018 School of Medicine, and the first thing that came up was your video from the first year of Funk, right? Was that great? I thought you wanted Bruno Mars, maybe. The video has 270,000 views. And while I was very inspired by your great dance moves and the jubilation about the pass-fail thing and and the ability to watch the lectures the next day, I needed to know more about your class. So I called your class president, Dr. Jorge Zarate. Congratulations on graduating today. And he told me that your class came together the week of the tragedy that happened in Ferguson when the unarmed Michael Brown was killed. And in what only could be the most cruelest of ironies, today we meet again as you graduate. On the day of your graduation, we have another shooting in Texas where 10 people have already been killed. 10 children have already been killed. And for that, and I took permission from the Chancellor, I'm going to ask for us to all rise for a moment of silence for all those who have lost their lives. Please sit down. Thank you very much. Now, I got to know some of the students from the class who has been impacted by all of this. And what all of you have told me is that you all want to make a difference. And you know what? I believe you. I believe in you. Because in you, I see people who will make a difference by not only living the American dream, but by actually upgrading it. What do I mean by that? You know the American dream where we're supposed to get a house and a white picket fence, a house with a white picket fence, and maybe a car and a corner office? I think you want an upgrade version of that dream, where not only do you have those things, which you'll easily have now that you're physicians, but you're able to actually live a life of meaning and purpose and have an impact to society. I am inspired by the data on graduates like you that comes out and says that all of you reject inequality in all of its forms and want to ensure that all of us have those fundamental rights of life, liberty, and the pursuit of happiness. And as the protectors of life, as doctors, don't you think it's our moral duty to ensure that everybody has that access to a great life and the best possible health care? And being that all of you together are going to touch 1/5 of the economy, and you're going to take care of patients, rich or poor, all of us have the opportunity to make a difference. Now, I must say this really is my first time giving an address of this nature, and so I did look at other videos before doing this. And you know, I found something, Dean. Most of the medical doctors, they talk about the joys of practicing medicine. The basic scientists talk about the wonders of nature. The ER, or emergency medicine doctors, talk about all the other doctors. And the surgeons, well, you know, we're so modest, we always talk about ourselves. So I'm going to talk about, my own career and 3 stories from it that will give you some examples of how I've worked towards being a doctor, a scientist, and a team member, and being part of a team that's dedicated towards eradicating healthcare disparities. So here's story number 1. I was a trauma surgeon in Baltimore at Johns Hopkins, as you mentioned, for many years. And at nighttime, the pager goes off, and it says, 22-year-old male, GSW, or gunshot wound, African American, CPR in progress, 2 minutes ETA. Now that's the kind of page that happens almost every day amongst urban trauma centers and happened multiple times at your own hospital last night. Now I rush down to the trauma bay. I'm at the foot of the bed. The emergency department attending is at the head of the bed for the airway, and our chief resident is kind of in the middle. The patient is rushed in. The paramedics put him on the gurney, and I look right at the paramedics and say, "How long has he been down?" The paramedics say, 7 minutes. Now you all know we have about 10 minutes, right? So I look at the chief resident, and she's ready to go. She starts an emergency room thoracotomy, right? And what this is an emergency operation right there to go in and see if we can fix major injuries to the heart or blood vessels. You could think of it like a Hail Mary pass in football. As I walked to situate myself next to the chief resident, I realized that there would be no touchdown today, that there were such severe injuries that this was just unsurvivable. We had to pronounce the patient dead. There were 2 medical students, and we showed the medical students the injuries, and then it was time for us to go and discuss this outcome with the patient's family. The social workers told us that the family was in this large room. there were about 24 people in the room. And given that the chief resident had started the operation, we decided that she would be the one to deliver the news. And so she walks in, and she's taller than me. The ED attending walks behind her. He's taller than me as well. There are 2 medical students. They all walk in front, and I'm behind them. And as we all walk in, and remember, I'm behind them, this room full of people, there's an older lady sitting over there in the corner, and she looks at me and says, "Oh my God, it's you. He's dead." And with that, there's complete pandemonium, commotion. Some people begin to cry. Some people get up and walk out of the room. And the chief mouths to me. She says, "I didn't even say anything." And I look at her and I go sit down. I sit down next to this older woman and I say, I try to recognize her. "Do I know you?" And she says to me, "Yeah." And I know who she is. She's Kenny, and I'm making up this name. She's Kenny's grandmother. Kenny was my patient from about a year ago. Kenny was shot in his liver. He was an 18-year-old black kid. He was taken right up to the operating room. He had a large hole in the liver. We fixed that hole. And then we were able to, and he survived. He had multiple takebacks back and forth to the OR, but he did survive. And what this grandmother told me, that when I came out to tell her those news, it was a few hours later, it was in a different waiting room, and I was all pumped up. I had my chest high, and I was looking at her, and I told her what a great job we had done. But then 3 months ago, there was yet a third grandson of hers who was shot in the head. And I pronounced him in the emergency department. And that day, similar to today, when I walked in, I was looking at the floor when I walked in. How is it that we live in a society where grandmothers know what the outcome of an operation is so well because they know the local trauma surgeon better than a family practice doctor, right? How is it that we live in a society where there is a 20% increase odds of death simply because you happen to be black after traumatic injury? This incident really brought me to the work I'm doing today. Remember, as you mentioned, I'm the son of immigrants, and I had planned to have a career in global surgery and global health, and maybe I'll go back to that career one day. But this was immediate, and I felt it was necessary to work on this right here at home. And so lesson number 1 is, be open and listen for your passion, and when you feel it, pursue it. Sometimes your passion chooses you. Now, the second story is a little shorter, and that's about what happened when I started saying, okay, we need to fix this. As you heard my introduction, I was like, my goal is to eradicate disparities. So I thought, well, I'm a surgeon, and I should be given all the money in the world to go do something about this. And so I wrote grant after grant after grant after grant. And you know what happened? They all got rejected after rejected after rejected, right? I was like, but I'm a surgeon. You have to fund me. And then I called a program officer at the NIH. I said, well, what's the problem? Why do they keep getting rejected? And he said, well, I'll be honest with you. When they review your work, they say, well, good that he's a surgeon, good that he has passion, but the trouble is he has no training in social sciences methodology, no training in how he's going to understand the mechanisms that lead to this kind of social inequality, so we don't think he'll be able to do this kind of work. And so I said, okay, well, what should I do? And I went and spoke with my mentors, and then my first grant ever was actually a career development award. It's called the K Award. And by learning the methods and learning from my mentors and becoming an expert in the field, then only people started to take me seriously, and we started to be able to do this kind of work in a much more methodologic fashion. So lesson number 2, be humble. And I know this is a surgeon saying be humble. Be humble, acknowledge your gaps, and address them to truly master the terrain you're trying to conquer. Now, that being said, passion and mastery isn't enough. So my third story is about finding your team and your teammates. You have to be in a group kind of like those caravans of the past, when like-minded people would get together and then go out west to try to do something, and they would take care of one another. And here's an example of how that worked for me. The first time I ever presented work on healthcare disparities in trauma was at the American Association for Surgery of Trauma. Now, this is about 10 years ago, and please remember, we talk about healthcare disparities, right? How many people know about healthcare disparities? Raise your hand if you do, right? Most of the people who study here know about it. But in the world of trauma, most people thought that there would be no healthcare disparities, that because of its emergent nature, it would be immune from these kind of problems, that everybody has access. The emergency department is the great equalizer, right? And so when the first time in this large room of hundreds of surgeons, when I showed that, we found that African-American children had an increased odds of having a deficit in their ability to talk, in their ability to walk, in their ability to eat after severe head injury compared to white children, some people liked it, some people didn't like it at all. In fact, after the first few questions, there was a person who got at the back of the room, and I remember it like it was yesterday. The guy gets up at the back of the room and starts screaming. He says, "This is bullshit." And maybe I shouldn't have said that. I'm sorry. But that's what he said. And he started screaming. And then he approached the podium. And then I got off the podium, and he's kept on screaming at me. And then at that point, my mentor, Eddie Cornwell, came up to me and started walking me away from this guy. And he said, "What, you're not going to let him answer the questions?" And my mentor looked at him and said, "If you talk like that, you're just not worth talking to." Right? As I walked out of there, other colleagues kind of gathered around me. And they said, "You should be able to publish this work." He kept on screaming, he's never going to let me get that work published. It's like, "Oh, you should be able to get this work published. That's not right. We're going to help you. We're going to do this kind of research ourselves." And then we created this National Disparities Working Group. Then the American College of Surgeons, the president at the time, L.D. Britt, took notice of us and said, "We're going to make this a big thing at the college." He was very interested in this. And then the NIH got involved, and we created the NIH ACS Agenda for Surgical Disparities Research. And now the NIH has funded at least 10 R01 grants in the field. So lesson number 3, find your caravan and don't let go. Some days you'll lead, and some days you'll follow. Your caravan of teammates will aid you on your journey. Now, being a skeptical surgeon myself, I know many of you might be thinking, well, he's just oversimplifying this. He was probably just lucky. And trust me, I know I'm very lucky. You might say that I came up in a different time and it's different now. And you know what? It is a different time. This is a time in our country where we are very disunited. There is extreme inequality. The American dream, or even quality healthcare, is out of reach for far too many. Closer to our profession, there are issues with disruptive physician behavior, physician burnout, the crazy costs of healthcare, gender inequality in medicine, and of course, a lack of funding for science. So if you just dismiss me as another speaker with lofty rhetoric and unattainable ideals, I would not blame you. But please remember, it is darkest before the dawn. These are unparalleled times, and unparalleled times provide great opportunity to make a difference. And if you want to be reminded of how people make a difference, just look at those kids from Marjorie Stoneman Douglas High School. They created a movement that many adults could never achieve. And today, again, there's a shooting, and it reminds us why there must be a movement now. So if you're ever told that you're too young or too junior or too low on the totem pole to start a movement, don't give in to that. There is no better time than today to be out there living your upgraded version of the American dream and enjoying a life full of meaning and impact. Now, I know that most of you will not be working directly on inequality, and that's fine. You might be focused on other things like solving Alzheimer's or beating cancer or creating a new flu vaccine, or perhaps most importantly, just focusing on taking care of patients. But these 3 tenets that I've talked about, finding your passion, developing your expertise, and then creating your caravan, should work all the same. And as you're out there doing these amazing feats of science and being a great doctor, if you do find the opportunities to make a difference in equality, please try. There are simple things you can do. If you're in a residency program where you find that there are not enough opportunities for underrepresented minorities, say something about it. If you see that one of your colleagues is being mistreated because of the way they look or their sexual orientation, speak up. And if you see that a patient is getting a raw deal because of who they are, what language they speak, what their skin color is, definitely you can do something about it. And if you want to do more, there are great organizations that you can volunteer with towards inequality. Right here in St. Louis, I got the opportunity to spend some time at the Better Family Life Center with Dr. Lori Punch, who took me there yesterday. You guys love Lori, right? Let's give her a round of applause. Because if we work together, we can create a world where equality really is the cornerstone of medicine, and there are no more grandmothers who are burying 2/3 of their grandsons before they even get to age 21. Now, as I close, I do want to recognize that you will face some hardships. Not everything will go the way you want them to go. You might lose a patient on the table. And Dr. Eberlein can tell you that happens to surgeons, and it certainly happened to me. You might have a grant that doesn't get funded, or you might have an idea that's not really taken well at a conference. But in those moments, I want you to think how it felt when you walked across the stage today and got that WashU diploma. And remember that you are a graduate of the class of 2018. You really are one of the best of the best. You have the training, the skill, and grit to have an impact. You are a member of the class who refused to just accept the status quo, and you are destined to make a difference. Good luck. God bless you all. God bless America. Thank you very much.
That was beautiful. Thank you, Dr. Haider. It is now my pleasure to introduce one of our graduates, Dr. Paolo Dib. Doctor. Who will begin presenting the awards from the class.
Thank you, Dean Perlmutter. So earlier, Dean Perlmutter said that this is going to be the dry graduation. And although I'm really happy to be dry right now, my goal with this award presentation is that they're anything but dry. So here we go. In 1966, the graduating seniors inaugurated a Teacher of the Year award to be presented to a faculty member who was the outstanding teacher in the eyes of the graduates. Since 1970, each graduating class has selected 2 individuals, one from the preclinical and one from the clinical faculty, to receive a Teacher of the Year award. Dr. Crouch is known to us as the second-year course master of pathology. She has been faculty at WashU for the past 35 years. In addition to being a professor of pathology and immunology, she is also a lab director of molecular pathology and an attending in the division of anatomic pathology. That's a lot of pathology. But that's really only a manifestation of her passion for it. It reminded me of the first day she came into lecture. And from the very first day she came in, it was obvious she was teaching us about her passion. I actually went back to that lecture, that video recording of the lecture, and rewatched it. It reminded me of how strikingly well organized, thorough, and clear it all was. Not only was she up to date with the most recent medical literature, but she always also included a splash of personality. This ranged from quick animation of stars and trains flying across our PowerPoints to mnemonic pictures that help us remember key information. Those mnemonics unfortunately often involved food, things like spaghetti and meatballs, for example. And I'd like to add one food mnemonic on the occasion of my birthday today. One of the mnemonics used was cake. Pathologists describe a certain belly abnormality as a mental cake. Either way, these mnemonics came in really handy during test time. We're able to recognize yeast cells, for example, because they look like spaghetti and meatballs. Now, some of us here might not look at certain foods the same way anymore, but I think it's all worth it. Dr. Crouch, your unfailing dedication to high-quality materials continued for the rest of the year. We often heard from her as she would check in with us, always trying to improve her course. And there are many examples of that, but however, there's one story I'd like to share that's going to convince you that she cared. One Tuesday evening, our class received a particularly memorable email. In that email, there was a poll where she was asking us our preference between the usual laser pointer during lecture or a new pseudo-green laser pointer. While only a pathologist would really know what pseudo-green is, this poll only spoke to how much Dr. Crouch cares. I was actually curious to know how many times she's gotten this award, so I went to a person in the know in the office, and the answer I got, and I quote, was a bazillion. In reality, after looking it up, I found out she had received it 11 times. That's roughly a quarter of all awards given since 1970. When I speak about Dr. Crouch's impact on our training, there's one aspect I can't fail to mention. It's one where she shared her personal experience during our first year practice of medicine course and helped us grow not just academically, but also as individuals, broadening our worldview and making us better future physicians, or I should just say physicians at this point. Dr. Crouch, thank you for all you do. Your work is inspiring, your knowledge is intimidating, and your humor is energizing. It's no surprise you have received this award more times than we can count. And just in case you're wondering, I voted for the pseudo-green laser option. In fact, I have one with me right here as a souvenir from our class. So it is my honor to announce Dr. Erika Crouch, the 2018 Preclinical Teacher of the Year.
Thank you, class of 2018. I really can't tell you how privileged I feel to be here after having a chance to work with you at such an early stage in your career. I appreciated the chance to be able to share my story, but also be able to share with you information about the language, mechanisms, presentation, and diagnosis of disease, which is really something I enjoy. I know you're all hoping that I'm probably going to leave you with one last pearl of pathology, or maybe another reminder about lifelong learning, but I don't think I'm going to do that at all. In this special moment, you're ready to jump off into a new stage of your career, and your faculty, or at least I do, I'm sure all the rest do, we start feeling very parental in the sense that you're really part of us. You're our future, and some of you are leaving us. So I prefer to leave you with a couple personal thoughts, things that took me a long time to learn, maybe that I struggled with, and I hope maybe it'll be helpful as you move ahead in your life and your careers. First, you're going to be very busy in the next few years, maybe the busiest. I doubt it. It gets busier all the time. But take the time during that busy time to nurture the relationships you have with your family, with your friends, and your close colleagues. It's really these relationships that make life so worthwhile. They make so many of our memories, and when times get tough, those are the things that are going to sustain you. It's really easy now. When I was in medical school, it was a trek back to the phone and maybe missing some calls, but now you can pick it up. You have good thumbs, and you can just say, hey friend, I'm crazy busy, but I miss you. I'll call you on the weekend. Just connect, stay there, stay close. This is really important. It will give you strength. Second, I think it's exceedingly important to just strive to be thoughtful, kind, and caring, not just in your personal and professional interactions, but really with everyone, all the time, everywhere. This is really one of the most amazing things. I can't tell you how valuable it is just to try to connect with people in this way. It's like a magic oil. It just makes everything work so much more smooth. You have the opportunity to, it just is an opportunity to really have a life that is much, much calmer, lower heart rate, happy microbiome, things like that. Lastly, it's really important just to really accept yourself. We're all different, and you need to accept what you can be. I think it's very important to try to understand what you need to feel really whole. And I guess we're hearing a lot about passion, but how to find that passion in life, that energy that just kind of drives you to do something and excel. I feel passionate about learning new things. I feel passionate about teaching and planting seeds. And I think one of the greatest joys is coming back to graduation a few years later and seeing how that garden's grown. Thank you very much.
Right. In 1979, Dr. Sidney Pearl, an alumnus of the class of 1932, established an award for inspirational teaching. Dr. Pearl stipulated the awardee was to be chosen by the graduating class from among the clinical faculty. The awardee receives a plaque, and the awardee's department receives a monetary gift. Dr. Tammy Sonn is known to us as the third-year clerkship director of Obstetrics and Gynecology. Besides having completely revolutionized the clerkship, she's an incredibly talented, dynamic, and caring teacher. This is also not Dr. Sonn's first time receiving this award, so rather than focusing on a long list of qualities, I'll convey them to you in two stories that I happened to witness. The first story was just from last week when Dr. Sonn was inducted by the students into the Gold Humanism Society. Upon receipt of her Humanism Award, the words she shared perfectly exemplified her humility. After thanking the students, here's what she said to them. Working in my office, everything feels like a whirlwind. And I feel like I pull you students into that whirlwind. So if humanism is what you see in that whirlwind, that's great. So this is just an example of how Dr. Sonn downplays her own successes and attributes them to her students. The second story I'd like to share is from about a year ago. As some of you might know, Dr. Sonn works on the labor and delivery ward. And I personally had the opportunity to work with her there. I still remember clearly, it was a Sunday morning. I was finishing a very exciting overnight shift where for the first time I had the chance to deliver 2 babies. But, as the saying goes, good things come in threes. So a third baby was on the way and I was assigned that delivery. As it turns out, though, the third delivery was more complicated than the previous ones. There was bleeding and the mother required some suturing. Hesitant about my ability to be helpful in that situation, I quickly stepped back, letting Dr. Sonn take over. But instead, she asked me to step back in and coach me throughout the entire procedure, and throughout, I felt supported. I was leaning on a rock. Now, the more impressive aspect of the story wasn't just her ability to instill confidence, but it was also her fantastic multitasking. Throughout the whole event, Dr. Sonn was maintaining an upbeat conversation with the mother with a big smile on her face and a comforting nod. I think she might have been discussing the pros and cons of baby Einstein. I'm not sure. My focus was elsewhere. As you might imagine, from my perspective, that whole story felt like a whirlwind. But in that whirlwind, she found a way to bring confidence to a student and reassurance to a mother. Dr. Sonn, Earlier this year, we were honored to present you with 2 teaching awards, but because good things come in threes, today we present you with the third. It is my honor to announce Dr. Tammy Sonn, the 2018 Sydney Pearl Clinical Teacher of the Year.
Thank you. Thank you so much for this honor. So in my message here, I wanted to just share with you just a few thoughts. As you move forward into residency, I'm really hoping that you hang on to some excellent teaching role models from your student years. And for this brief moment, I'm going to have you actually think for a very specific example of a resident. So if you can think back to a resident specifically over the past several years that you have in mind that was a great example, so nothing negative, but a great example of someone that you want to emulate, you know, that you are like, oh, got to remember that, got to remember what they did. Have that person in your mind. And I would say that the odds are high that they were probably somebody who was a really excellent teacher toward you as a student. I think the odds are also really high that they probably have at least 3 of the following attributes that I just want to highlight as qualities that I think are really important. One is inclusivity, so somebody who basically can kind of involve you as a learner into the team, kind of bring you into the fold really easily, that despite being on a service for merely just 2 weeks, they give you a very clear role, they give you a purpose and a sense of what your function and role is as a part of that team. And in that also just talks with you on a normal level, doesn't talk down to you or doesn't talk to you at all, possibly. So again, just that inclusivity. The second is care. And I know care, we use that every day. What does that really even mean anymore? But actually on an everyday basis, I feel like this is one of the most deepest motivating factors for me personally too, as something that's going to drive kind of a self-sacrifice, that you're going to spend time and take that out of your day to do something because at the bottom of it all, it's because you care. So for example, you're imagining that you're a resident, been a really busy week, super busy week, and you told your team that, yep, we're gonna do this didactic. We're gonna do that. In fact, you assigned some articles for the students to read, you know, they prepared, and at every turn that there was a moment, something came up. So super busy, and of course it's Friday evening. And you could easily just kind of be like, oh, what teaching didactic, and forget about it. But instead, you plow through. It might make it a little shorter, but you still do it. Why? Again, because you care. The third item is presence, and it's that ability to be fully aware and engaged with an individual person or your team. And despite all the craziness as a resident, right, the emails, the texts, the pages, you are pulled in many different directions by the hospital staff, that despite all of that, you are still going to be fully present and engaged on an individual level when people are interacting with you. You're going to look up, make good eye contact, you're going to listen to them, you're going to make all of your attention be on them in that mere small moment in time. But all of those little small moments add up to big moments, and in the course of your residency time period, you're going to be grateful for all of that trust and relationship that has built because of your being just fully present in those moments. It'll make for a much better, easier life for you as a resident, and also I think also it just improves patient care too at the end of the day. I'm going to leave with one little short story. Some of you just may know that my oldest son, Ethan, he is 8 right now, but back when he was about 4 or 5 years old, he was in the middle of taking a bath and suddenly kind of looked up at me with this kind of realization, and he said, "So, Mommy, do you take our car when you deliver babies?" And I, for a moment, paused out of confusion and was like, "Oh, right, so actually, Mommy is a little different than the pizza delivery person." So I share that just because I hope that for the time you spent with us on service, I hope that what goes on in a delivery was illustrated a lot more clearly. Thank you, class of 2018.
Thank you, Dr. Perlmutter.
So now it's time for me to say a few words, a few remarks for our graduates. On behalf of our faculty and staff, I want to tell you how happy we are for all of you, how proud of you, and we are so grateful for what you have meant to our academic medical center over this last 4 years, or for some of you, even longer. You have brought energy and curiosity and intellectual challenge. There is an ancient saying, what you leave behind is not what is engraved in stone monuments, but what is woven into the lives of others. And all of you are now woven into our lives and into the fabric of what we are as a school. And also on behalf of our school, I want to extend our congratulations to your parents and members of your family. It has been a long journey for all of them, and their love and support has been instrumental in what we are celebrating today. So let's give another applause for your families. A few weeks ago, I read a column in the Sunday New York Times that I believe captures a lot of the challenge that you, our graduates, will encounter as you move into the next step in your career. And it also captures the unique moment of your graduation within the history of medicine. And I say this because of the current revolution in the way you can access information electronically. It's a column by one of the senior medicine and science writers, Gina Collada, and it's on the back of the front page in a format called the Times Insider. And I quote, Times Insider delivers behind-the-scenes insights into how news, features, and opinion come together at the New York Times. It's not very long, and so I can read it to you. The title is, not too long, the title is A Medical Tip's Unexpected Outcome. And I quote, it wasn't supposed to be like this. When a reader sends a tip to the Times, we investigate it, and normally one of two things happens. It becomes a story or it doesn't pan out. What's unusual is when the course of investigating a tip leads a journalist to debunk it, and that becomes the story. In my 30 years of writing about science and medicine for the Times, it had never happened to me until now. And although I wavered for a while about whether to go ahead with the reporting, it ended up as an article about doctors' hesitation to use tissue plasminogen activator, TPA, a drug for people experiencing stroke. It started with a tip in February from a Canadian emergency medicine doctor who said in an email that TPA, a widely promoted drug, was not only useless, but dangerous. It could cause bleeding in the brain. Yet the drug was advocated by medical societies and continued to be used, he said, because there were powerful corporate interests influencing practice guidelines and encouraging doctors to believe the drug worked. I knew about TPA and had always thought it was the only treatment that reduced disability when given to people within a few hours of a stroke caused by a blood clot that blocked a vessel in the brain. Had I been duped? And Collada goes on. I called the Canadian doctor who said there were 15 clinical trials of TPA in stroke patients, 13 failed to show a benefit, and the 2 that found one were deeply flawed. He referred me to an emeritus professor of emergency medicine at UCLA. I emailed to speak to him and asked for suggestions of others who also questioned the drug. And I emailed a Harvard professor who is a stroke expert. The Harvard professor got back to me immediately. Oh no, he said, not that small but vocal group of disbelievers again. The TPA data are strong and convincing, he said. The failed trials were ones that tried to expand the use of the drug, for example, by seeing if it was possible to extend the time interval when the drug was effective beyond 4 hours after the stroke began. He emailed a group of academic stroke experts asking them to contact me. I can always tell when a story hits a nerve. People rush to call or email. That's what happened this time with the TPA advocates. My inbox was flooded. One American doctor emailed me from Saudi Arabia, where he was giving a lecture. I also spoke to dissenters, and it seemed that the evidence in favor of the drug was overwhelming. The major professional societies, after reviewing the data, had given it their highest possible recommendations for use. What to do? The tipster had acted in good faith, but his tip had backfired. The simplest thing would be to drop the story. I told the UCLA professor what I was hearing. "This is no surprise, Gina," he said. He knew many neurologists adamantly disagreed with the dissenters' views, but said he had also heard from neurologists who told him that they felt great pressure to give the drug. They feel that it's a bit of career suicide if a neurologist bucks his or her professional spokespeople. By now, I was fascinated. What I was seeing seemed to be the medical version of fake news, with TPA skepticism being spread by social media and blogs. The result is that as many as 15 to 30% of stroke patients who could have been helped by the drug did not get it. I wanted to write this story, but I needed a victim who knew about his or her missed chance. Many never find out. I found one, the father of a researcher who was a principal investigator for the original study showing TPA worked in strokes. But when this expert's father went to an emergency room with a stroke, the doctor there refused to administer it. The TPA advocate's father denied the drug was permanently disabled. Quite a story. Two completely different interpretations of existing data. Skepticism about potential conflicts of interest and financial incentives. Conspiracy theories that spread rapidly on the internet. And when I think about your future, our future, that profiles of each of us will be created by the Googles and the Amazons so that our tendencies can be used to populate our searches. It will be even more challenging for us to filter, to sift, to appropriately handle a world in which the amount of information available is mind-boggling. The big question is, how will you handle it? What will you do in your own practice? You already know from your experience here that there may not always be one approach that is right and another that is wrong, and that it may depend on something specific about the patient or the setting in which you are seeing the patient. How will you handle uncertainty? How will you learn the evidence? And will you keep up with the latest advances in healthcare as science and technology are inexorably marching along? Everyone up here believes we gave you the foundation. This is why we taught you the basic sciences and statistics and how to interpret the literature, how to make sure you understand all about the opposing view and why it doesn't meet the stringency test to invalidate the mainstream approach, how to deduce when something makes sense in the clinical world, how to ask, how to learn. A few days after I read this article, one of your classmates asked me what were the keys to a successful career as he moved on to residency. Many, many things came to my mind, but two stood out. Insatiable appetite for learning, laser-like focus. And I believe these are the two things that will help all of you, all of us, to address the situation Gina Colada wrote about. These two things are not exactly congruent. An insatiable appetite for learning is a form of openness, and it is critically important that you open yourselves to learning about everything. You will need to learn about all the science and all of the art of medicine to have a great career as a physician. You must read about the opposing view and be able to judge it on its merits and whether it is biased by conflict. But laser-like focus is a form of closure, of narrowing, and it is also essential to a great career. In particular, it will be essential for your residency and fellowship when you have to prioritize every minute of the day. How can you be both? Open to learning everything, but focused on one thing at a time. It will not be easy, and it's such a noisy world, and now it is almost as noisy outside the hospital as it is when we're inside the hospital. But you must do it. What I have seen in the most successful physicians is that they know how to compartmentalize their time. They work hard and constantly work at improving their own efficiency and effectiveness. They set aside time to read regularly, consistently, and broadly. They never cease to educate themselves. And by the way, as you heard earlier, they always make sure to set aside time for their families and their friends. This will not be easy either, but a life outside of medicine that is rich and meaningful will make you even more successful in your career. You work hard, but when you get in the car to go home, work is over, and the other part of your life is essential. Compartmentalize your time. And please never forget the lessons you learned here from your teachers and mentors about compassion. This is such an important part of your education so far, and you must keep working at it. When people come to you for medical care, they are always at their most vulnerable. In many cases, it's not just your skill or your knowledge, but the little things that make a difference for your patients. Knowing them, being there at critical moments, giving them confidence that the next step is the right step. You will be surprised at how important these simple things are to families at vulnerable moments. I want to end with two wonderful passages from Dr. Seuss. And for you, I have taken the liberty of stringing them together. The more that you read, the more things you will know. The more that you learn, the more places you'll go. And will you succeed? Yes, you will indeed. 98.75% guaranteed. It is now time for each of you to go on from here with an insatiable appetite for learning, laser-like focus, and compassion. We know you can do it, and we know with those things you will have a life like the one recommended by Dr. Seuss. Congratulations to all of you. It is now my pleasure to introduce our Chancellor of Washington University, Dr. Mark S. Wrighton. Mark is the 14th Chancellor in the 165-year history of Washington University. He is a brilliant chemist. He started his PhD studies at Caltech and completed them at age 22. He then joined the faculty at MIT, where he carried out groundbreaking work on photochemistry and the use of transitional metals to develop electrochemical devices. He was promoted to professor in 5 years and was awarded a MacArthur Foundation Genius Grant 10 years after starting his lab at MIT. Chancellor Wrighton has dedicated himself to leadership in higher education, first as provost at MIT, and then for the last 23 years as our chancellor here. His impact on American education has been enormous, in particular as a force for global involvement with the revolutionary McDonald International Scholars Academy, his role in advancing the mission of our medical school, and in particular the evolution of Siteman Cancer Center, and many other accomplishments that have continued the tradition of wonderful excellence and important contributions to society by Washington University. Please join me in welcoming our Chancellor, Mark Wright.
Thanks, David. It's really a pleasure to be here, indeed a privilege to be able to talk with these outstanding graduates of our School of Medicine. I know that perhaps most of you were a little wet this morning, but you have now earned the title doctor. Congratulations on your achievements. At our commencement ceremony this morning, I conferred an honorary Doctor of Science degree on Eric Green, who is an MD, PhD graduate of Washington University School of Medicine. He has had an outstanding career, and he has been, in fact, instrumental in helping many institutions, including Washington University, in advancing the field of genetics and genomics. This work has opened up the opportunity for providing personalized medicine. And indeed, this is one of the lead initiatives that Dr. Perlmutter has ushered in here at Washington University, personalized medicine. You've heard earlier in this program this afternoon about the importance of overcoming health disparities. I see enormous promise in what we're able to do in personalized medicine. But there is the concern that this is going to be medicine for the affluent. How will it be possible to bring personalized medicine to all? This is an enormous challenge, but we're embarking upon that program, and I know that many of you will continue to be involved in advanced medical research that can be applied to helping people. I appreciate very much the hard work that you have expended in earning your medical doctorates. You have an important degree that has earned that title, doctor. I'm a doctor, but not the kind that can help you. You can, and I know you will. Thank you very much, and congratulations to the class of 2018.
It's my great pleasure now to introduce Dr. Jorge Zarate Rodriguez, President of the Class of 2018. Jorge, would you please come to the podium to give your address?
Thank you. All right. Dean Perlmutter, Chancellor Wrighton, Dr. Haider, esteemed faculty, family, friends. It has been such a privilege to be part of the class of 2018 and to bear witness to everything that we've collectively accomplished. But there's a Mexican saying that my mom always likes to remind me of, no te hiciste solo, which translates clunkily into English to, you didn't make yourself all on your own. So to follow suit from our other speakers, in other words, it takes a village to raise a doctor. So I wanted to take a moment to thank the faculty, family, and friends in our respective villages who have helped us make ourselves. So we're gonna clap again. Yeah. I feel honored to have the opportunity to address you one last time as your class president. I have been charged with the wonderful task of recounting what the last short 4 years have been like for us. This wild roller coaster started one very hot and humid August morning, but we didn't all start at the same place. Some of us came straight from undergrad, still very green. Some of us took a couple years off to do a little growing up. And some of us came already grown, with children, a law degree, and a spouse we had to talk into agreeing that 4 years of lost income wouldn't be that bad once we became dermatologists. We might have started at different places, but we were certainly all equally excited to put on those crisp white coats for the first time. First year was a blur of new friends to be made, nerves and arteries to dissect, and splotches of pink and purple we had to pretend we could identify as legitimate histological structures.
It was also first year that we learned our med school classmates weren't only good at cramming Constanzo's physiology or throwing amazing shell parties. We also had amazing choreographers and dancers in our midst. Manoj Ara and Randy Chang led the Heartthrobs to victory and to eternal infamy as the hottest boy band to grace the stage at the Red Dress Affair. Amongst this lot, there's also actors, screenplay writers, directors, and producers. Like you've already heard, our music parody video, First Year Funk, directed by Travis Creefcore, went semi-viral and got featured in a late-night TV show that made fun of unnecessary parody videos on YouTube. But as they say, all publicity is good publicity. Johnny Labin and Ben Maserano took the class show and turned it into a really elaborate affair, setting a new standard for class show production value and redefining what an appropriate length for a school function should be. In a blink of an eye, our last summer ever came and went, and we found out that 10 weeks goes by a lot faster than you'd think. And so we started second year with confidence, but we were quickly brought to our senses when we had to learn all of pharmacology in just 2 weeks, which would truly set the tone for what would be one of the hardest years of our lives. We spent countless hours in the carrels and in the fourth floor of Becker, where there used to be tables, desperately trying to balance studying for STEP and studying for our courses, because back then, when the walk to school was uphill both ways, second-year courses were not pass-fail. Several billion Yankee cards later, and after Alec Wright had eaten his body weight in free pizza many times over, we finally took step one. Like David against Goliath, we came out victorious on the other end, and we were finally ready to see patients. We put on our still white short coats and bravely crossed Euclid Avenue to enter the hospital with a reflex hammer on one hand and an ophthalmoscope on the other, neither of which would get much use, but we didn't know that then. We also didn't know that immediately post-step would be the smartest we would ever be, and that all the mucopolysaccharidoses and all the glomerulonephritides would fall right out of our brains overnight. At the beginning of third year, we had to say goodbye to the MSTPs who started with us, but we also got to meet a whole batch of new MSTP friends who are finishing with us today. Together, we somehow made it through the long hours of surgery, the patients with too many comorbidities of medicine, all of the fluids of OBGYN, and all of the smells of pediatrics, to finally reach the promised land, fourth year. We started the year working hard to impress our letter writers during our sub-internships and during our away rotations, and then we racked up thousands of miles on Southwest, scurrying up and down the country with smiles on our faces, even though we were so tired of having to come up with fake weaknesses for the 100th time. Once the interview season was over, we all deservedly switched to cruise mode. We seized the opportunity to travel to places like Guatemala and Nepal, and we also partook in some very creative special study blocks. Some of us got engaged, some of us got married, and finally, we all celebrated with each other as we took the stage one by one to open our envelopes on match day. A couple of months ago, Dr. Haider and I spoke on the phone. He wanted to get to know our class better, so he asked me about us, what we were like and what we had accomplished. He asked me if there were any anecdotes that I felt encapsulated the personality of our class. And I've been thinking about that ever since, because it's difficult to sum up such a diverse group of individuals, but a particular moment does come to mind. As class president, I've had the opportunity to sit in on several curricular committees, and in one of them, we reviewed course report survey data. While looking at all that data beautifully displayed in one of those heat maps that Dr. Nunez loves so much, it struck me that across the board, for all 4 years that we were here, our class rated essentially every single course and clerkship more harshly than the classes before us or the classes after us. The committee had a good laugh about it and joked with me that maybe too much of my personality had rubbed off on the class. But in all seriousness, I actually think this exemplifies our class well. It's not that we like to complain or that we're trying to get back at our teachers. not all of them, at least. Rather, our class has an intrinsic, relentless desire to make things better. Our class has a hunger to push the envelope and to be agents of change. For example, Justin Porter, one of our MSDP colleagues who is now in the lab, walked into the free student-run clinic, the SNHC, as a first year, and thought there must be a better way to keep track of patients and follow up on their labs and on their imaging, so he built a brand new electronic medical record system from scratch. We have worked hard to try to improve St. Louis by demonstrating on and off campus against racist and sexist systems of oppression that affect us and our patients, from addressing gun violence as a public health issue to championing for women's safe access to reproductive health. Let us remember when Caroline Wentworth, Manuela Mejia, and Emily Ryan went on television to talk about the importance of sex education. We have also worked hard to improve the experience of the medical students to come after us and have made our mark at the institution, albeit sometimes a little too late for us to benefit from those changes. We leave behind a rich anthology of resources ranging from flashcard decks to study guides so thorough they would make Dr. Pike proud. But we have also lobbied for large-scale changes to increase inclusion and diversity, as well as med student wellness. Our class has such an honest commitment to addressing the failings of our healthcare system by serving the underserved that the class of 2018 is graduating the highest number of family medicine physicians that Washington University School of Medicine has seen in over a decade. For the sake of full disclosure, that so happens to also be true for radiology, but what can you do? Now, to bring this speech to a close, I'm going to ask you to think back to the beginning of medical school, all the way back to orientation. It was hot and humid, and we were all a little overwhelmed trying to keep straight our WasmKey login and MedPortal and WebStack and WUMSWeb. And Dr. Whalen, who is now Chief Medical Education Officer at the AAMC, spoke to us as we embarked on the beginning of our medical education. She told us one of the most important decisions we would have to make as physicians would be, are you going to be a rolled down or a rolled up sleeves kind of doctor? And I remember thinking very clearly, rolled up, how are you supposed to suture with these things? But of course it was a metaphor. Do you want to be the kind of doctor who just tries to make it through the day, or do you want to be the kind of doctor who engages? And our class pushes and strives for more. Our class engages. So as we take our first steps as baby doctors, remember this craving for excellence and allow it to provide direction for your careers. Become excellent clinicians, excellent physician scientists, excellent academic surgeons, teach excellently, diagnose excellently, advocate for your patients excellently, push for excellent health policy, become excellent healthcare administrators, and do excellent hip replacements. Continue to make medicine better. Class of 2018, it has been an honor to be your classmate and your friend. Now it's time to roll up our sleeves. Thank you.
30 years ago, the class of 1984 decided to take a professional oath and chose a modified version of the 1948 Declaration of Geneva. This year, we've asked Dr. Eva Aagaard, Senior Associate Dean for Education and Professor of Medicine, to lead the class in this oath. Eva?
I am so very proud of all of you and so very humbled to be able to lead you in this oath. Graduates, please rise and recite the Declaration of Geneva with me. It can be found at the back of the program. We're going to do this together. Ready? Okay. At the time of being admitted as a member of the medical profession, I solemnly pledge myself to consecrate my life to the service of humanity. I will give to my teachers the respect and gratitude which is their due. I will practice my profession with conscience and dignity. The health of my patient will be my first consideration. I will respect the secrets which are confided in me. I will maintain, by all means in my power, the honor and the noble tradition of the medical profession. I will not permit consideration of religion, nationality, race, party politics, or social standing to intervene between my duty and my patient. I will maintain the utmost respect for human life, even under threat. I will not use my medical knowledge contrary to the laws of humanity. I make these promises solemnly, freely, and upon my honor. Thank you. You may be seated.
It is now a pleasure to introduce Dr. Lisa Moscoso, Associate Dean for Student Affairs. Dr. Moscoso, will you please come forward to address the class of 2018 and to award the diplomas. Lisa.
Good afternoon, and congratulations to the class of 2018. As Dr. Aagaard said, we are so proud of you. This is my favorite part because we get to proclaim all of your full names. And the cool thing about that is that there's so many people in this room who were the first people to say your full names over 20 years ago. So it's an honor and a privilege to be able to do that. Dr. Slaughter this morning talked about truth, and one truth that we know already is that you have all earned the name doctor. And Dr. that can help us, Dr. Wrighton, this morning gave a very poignant and brief speech and talked about gratitude and how he is grateful for what you will become. We on this stage are so grateful for what you will become. So it is time. Let's do this. You ready? Okay. So will Dr. Perlmutter, Dr. Wayne Yokoyama, our MSTP director, Dr. Thomas Defer, Associate Dean for Medical Student Education, and Dr. Michael Donlin, Assistant Dean for Academic Affairs and Registrar, please come forward for the awarding of the diplomas. So the presentation of the degrees will have the following format. Although a few graduates are unable to attend the program today, I'll announce the full name of each graduate of the class of 2018. In addition, in your program is a listing of awards and prizes recognizing the outstanding accomplishments of our graduates. Graduates, these awards and prizes will be found in your diploma. So traditionally, the first Doctor of Medicine degree diploma is awarded to the class president of the graduating class. So will Dr. Jorge Zarate Rodriguez please come forward to accept his diploma? All right, congratulations. So the first group of graduates completed 6 or more years of medical and research education and are receiving both a Doctor of Medicine degree and a Doctor of Philosophy degree. Will the first row of graduates please rise and proceed to the stage, and as I read your name, you'll cross the stage and shake hands with Dr. Perlmutter and Dr. Yokoyama. Dr. Elizabeth Ann Germino. Dr. Gary Grajales Reyes. Dr. Monica Umesh Kusbaker. Dr. Daniel Martin Kaufman. Dr. Sarah Catherine Kaufman. Dr. Ranjan Dev Kumar. Dr. Jessica P. Miller. Dr. Patrick David Olson. Dr. Michelle Lauren Robinette could not be with us today. Dr. Gregory Vincent Scamitzi. Dr. Susan Chi Shen. Dr. Joshua Sarfati Siegel. Dr. Emily Ann Slatt. Dr. Benjamin David Solomon. Dr. Avik Som. Dr. Nicholas Paul Schramme. Dr. Manuela Veselinova Valcheva. Dr. Shaldi Wu could not be with us today. Dr. Christine C. Yokoyama. Yay. And Dr. Andrew Lee Young. The next group of graduates has completed a full year of research training in addition to the medical program and is receiving both a Doctor of Medicine degree and a Master of Arts degree. Dr. Brent Stephen Brook. Dr. William Diang Cheng. And Dr. Dong Young Lee. The next group of graduates has completed a full year of advanced study in addition to the medical program and is receiving both a Doctor of Medicine degree and a Master of Population Health Sciences degree. Dr. Jessica Kimberly Holtum. Dr. Ryan Jean Cronin. Dr. Angela Lin. And Dr. Michael Rubaka could not be with us today. And Dr. Lulu Yu. The next group of graduates has completed a full year of research training in addition to the medical program and is receiving both a Doctor of Medicine degree and a Master of Public Health Science degree. Dr. Vikram Aditya Shankar. Dr. Sarah Betcherwork Wandamena. The next group of graduates has completed a full year of clinical research training in addition to the medical program and is receiving both a Doctor of Medicine degree and a Master of Science in Clinical Investigation degree. Dr. Casey Michelle Belekas. Dr. Radhima Rao Gunaganti. And Dr. Roland Hahn could not be with us today. And the following graduates are receiving a Doctor of Medicine degree. Dr. Bilal Al-Khalil. Dr. Brandon Yap Altenhofen. Dr. Diane Jiwon Dr. Tyler Marcus Bauman. Dr. Julia Marie Berg. Dr. Amanda Lee Buzales. Dr. Christopher Allen Crofton Briscoe. Dr. Nora Catherine Burtis. Dr. Randy Owen Chang. Dr. Eleanor Rachel Christensen. Dr. Elizabeth K. Christensen. Dr. Avril K. Coley. Dr. Mary Dandulakis. Dr. Elizabeth Alexandra Daniels. Dr. Michael Brandon Del Valle. Dr. Paolo Dib. Happy birthday. Dr. Stephen Paul Erickson. Dr. Jennifer Rachel Farley. Dr. Amaryllis Fernandez Maldonado. Dr. Tienja Jessie G. could not be with us today. Dr. Saren Michelle Godalovich. Dr. Mindy Guo. Dr. Douglas Hall. Dr. Noreen Hawk. Dr. Thomas Sang-hyun Hong. Dr. Ling Ling Huang. Dr. Radhika Jain. Dr. Diana Jang. Dr. Talif Raza Khan. Dr. Julia Helen Kalaji. Dr. Katerina Sonn Konstantinov. Dr. Victor Joseph Wade Kovach. Dr. Dalin Chen Kwang. Dr. Jonathan Ernest Labin. Dr. Raman Matthew Lalazari. Dr. Fong Mai Lee. Dr. Laura Lee. Dr. Sonia Yanni Liu. Dr. Elizabeth Ann Meidel. Dr. Shamoida Majumdar. Dr. Jeffrey Michael Marenshaw. Dr. Alexander Markov could not be with us today. Dr. Benjamin Max Maserano. Dr. Kunal Mohan Mathur. Dr. Shagun Mathur. Dr. Sagar Devendra Mehta. Dr. Manuela Mejia. Dr. Christopher Alexander Mejias. Dr. Michelle Alexandra Mendiola Pla. Dr. Emily Catherine Murfeld. Dr. Gabriella Madeline Morris. Dr. Sindura Murthy. Dr. Adam David Naylor. Dr. Kenneth Frederick Newcomer, Jr. Dr. Gregory Ugochukwu Opara. Dr. Bo Tyler Overschmidt. Dr. Alexander G. Padovano. Dr. Galen Udell Pizarno. Dr. Naveen Kumar Pokala. Dr. Dylan Robert Powell. Dr. Cliff Harrison Pruitt. Dr. Max Sebastian Riley. Dr. Emily Joanne Ryan. Dr. Michael George Rizzo Jr. could not be with us today. Dr. Caroline Laverne Robb. Dr. Kristen Knutson Rosano. Dr. Tariq Salih. Dr. Christelle Desiree Quisha Seaman. Dr. Morgan Brooke Shore. Dr. Nicholas Richard Scott Wittenborn. Dr. Michael Engels Snavely. Dr. Andrea Nicole Soros. Dr. Rachel Christine Springer. Dr. Catherine Mary Stanley. Dr. Stephanie Teja. Dr. Andrea Tian. Dr. Angus Martin Sean Toland. Dr. Rubaban Tuba. Dr. Eric Joseph Weiner. Dr. Victoria Grace Wesevich. Dr. Jeanette Rosa Wong Siegel with daughter Liliana Siegel. Dr. Alec James Wright. Dr. Stephen Zhang. Dr. Linjin Zheng. And Dr. Aaron Jules Zuckerman. Ladies and gentlemen, the class of 2018. Thank you. This concludes the 2018 Commencement Recognition Ceremony for Washington University School of Medicine. Following the recessional, you're cordially invited to join us and the graduates in celebrating this amazing day with them by a reception hosted by the School of Medicine Medical Center Alumni Association, of which you are all now a part of, in the atrium. So just take the escalators up to the second level. Faculty and graduates, please rise for the recessional. And good evening, everyone. Thank you.